is in Osha. When I was doing inspection 6 years ago, we used to do 50% construction, 50% general industry, manufacturing. And we've recently switched that to 55% construction, 45% general industry because of the number of fatalities that occur in the construction industry. 20% of the fatalities occur in construction, 4% of the population work in construction. So it is disproportional, it does get our attention, and in particular this time frame, residential construction is on our radar. I've been with Osha for 26 years, most of them as a compliance officer out doing the actual inspections. Now I just sit and eat and drink and talk about Osha. I do have my certifications, so I'm certifiable. All of it's been in northwestern Wisconsin, so I do understand what type of construction, what type of concerns people do have in this area. Osha just went through its 40th year anniversary, so we are a relatively young agency, if you want to consider that. The other way to look at that is our standards are 40 years old, a lot of them. We haven't updated our standards like we want to. That's one thing in front of Congress right now is how to update standards without basically an act of Congress or act of God to get things changed. But when you say you comply with OSHA standards, you may be complying with 1950 standards that were adopted in 1970. So you're not doing a whole lot in the realm of being technologically advanced. Our mission is to ensure, so far as possible, every working man and woman in the nation a safe and healthful workplace conditions and preserve our human resources. This was passed under a Republican administration. Human resources are the people that work for you. If they are hurt, they're injured, or if they're disabled and they can't go back to work in construction, you have somebody on the welfare system, somebody in your forever debted in your insurance, things like that. So you have to take care of the people that work for you. And that's what they recognized back then. Our approach to this is strong, fair, and effective enforcement. This administration, under the Obama administration, is not as balanced as in the past. We are really strong in the enforcement. And I'll go through a couple things to show where we're going, what we're targeting, and how we're going about it. The second part there is the outreach, education, and compliance assistance. The Clinton-Gore administration put compliance assistant specialists in place, people in my position, and the goal there was to give people a resource and avenue to talk with someone from OSHA and get an answer, be able to come to presentations and do stuff. So there is a compliance assistance person in every office. We are still out there doing what we're doing, but there's more emphasis towards enforcement on this administration. Partnerships and other cooperative programs, I actually do have an alliance with WITC. I'm here fairly frequently, talking with their people or working, using their facilities for things, so it does work out really well. When you think of OSHA coverage, who do we have jurisdiction on, who do we cover? It's the private sector employees. The reason why this is pretty prevalent or why this is pertinent in construction is self-employed people are not covered by OSHA. So if you're taking a remodeling project or a small residential construction project and it's Joe's Roofing, and Joe's the only person who works for Joe and he's not incorporated, he is self-employed, solely owned proprietor, can do whatever he wants. And if you are hiring someone who is a self-employed contractor, they may act that way, but yet you may be dealing with the outcome of how they are going about their safety program and what they consider safety for themselves. We have a big emphasis within Department of Labor, the big Department of Labor, on people working for just 1099s. Okay, well, that's not my employee. He gets a 1099. There is a state of Wisconsin 14-point or 9-point test. There's the IRS 21 questions on whether you are truly a self-employed individual or not. A lot of it is, John, you want to work from, you want to help me on this job, and I'll give you a 1099. And you go, I have to go fishing today, and you go fishing. That's wonderful because you can, because you're self-employed. But if you say, no, you have to show up at 9, you leave at 3, or you leave when this is done, you are dictating the terms of that employment. So that is one of the things that, because people are working for cash, you're not paying taxes, Department of Labor has taken a more rigid stance on that. Farm family members, that's one of those things that the farms are getting bigger in this area in particular. That's basically all I did last year was dairy outreach. But those now we have the ability to do inspections with those individuals. Mine workers, all the sand pits going up and stuff, that's MSHA's jurisdiction. DOT, if there's an injury or fatality on the roadways, that's DOT. And we don't get involved, Nuclear Regulatory Commission. Public sector employees, so any employee here, we don't have the coverage. The employer is responsible to provide a workplace free from recognized hazards. They need to comply with the OSHA standards. I have some of the books. You need to know that if you're an employer. And be familiar with standards applicable in your workplace. So if you are a home builder, you need to know the regulations on home building. That's an expectation. Just like if you have a driver's license, you're going to another state, you're going to drive in their state, you are expected to know their laws. That's the rules of the road there. Employees have to comply with the rules and regulations that you establish. If you have safety glasses, hard hat rules, they have to do that. They have to report hazards to the supervisor. The rights, they get to look at the standards, get training, request the injury and illness records, and request on-site inspections if they choose to file an OSHA complaint. They cannot be discriminated against if they do file a complaint with OSHA. And we do have a whistleblower protection person that does follow through on that. If you were to get an inspection, it would be done by a compliance officer or a COSHO. So compliance, safety, and health officer, usually they can do safety and health. Being a small office, I had to do both. But they are a little bit different. If you're dealing with silica, sand, grinding on concrete and things like that, that's more of a health issue, the noise, versus the fall protection. Anybody from Minnesota? Yeah, besides you. We already did the business card. They won't give me. Because I don't, I can speak a little Minnesotan, but if you were to get a job in Minnesota and work construction in Minnesota, again, the rules of the road there changed because they're a state plan state. And the state of Minnesota runs their own OSHA program. The Eau Claire office monitors to make sure they're doing it per OSHA's guidelines. The state of Minnesota has to have standards that are equivalent or more restrictive than federal OSHA. A little bit different protocol, a little bit different things, but make sure you kind of look at that if you do Minnesota jobs. So the compliance officer gets to a job site in a number of different ways. One's called an imminent danger. If we drive by something, we see people hanging by their toenails off a roof, we can call that an imminent danger because if they fell, they'd be dead. If we see a trench that's not shored, we could do an inspection immediately because if that trench caved in, and trenches do, as they did last week in this area, people will die. So we call that an imminent danger. We would do that immediately. Fatality or catastrophe, if someone dies at your workplace, you're required to report that to OSHA. Within 8 hours, there's an 800 number, and it's manned 24/7, 365, so the call goes to the call center. The call center goes to the area director and then to the compliance officer. I didn't necessarily get called out of bed, but I had a few late night calls. Catastrophe is 3 or more hospitalized, and not just go to the hospital emergency room and then release, but actually admitted to the hospital. Employee complaints are very high on our agenda. However, in this region, employee complaints aren't that prevalent. If you were in a more industrialized, unionized area like Milwaukee, Ohio, things like that, they are driven completely on employee complaints. That's the only places their compliance officers get to. Referrals would come from another agency. Let's say DNR has stopped by your work site because you're dealing with asbestos, and they care about the disposal. They have no ability to manage how the employees are exposed to the hazard. So they would file a referral to us. Similarly, if we are there for employee exposure and we see people throwing asbestos in a dumpster, we would file a referral with that group. Planned or targeted inspections. In construction, we have what's called the U10 list, University of Tennessee. They gather all the construction projects, Western Builder, Dodge reports, things like that, from a region. They put it on a random number table, generate a list that gets mailed to the area office. So we don't have any ability to control that list. We complete the list. We may jump a couple of months and then go to the next list. The productivity on that one is not so good. A lot of times, by the time we get to a list, the project's been done. You start doing, pull up your project, and there's a road building job in December. Okay, don't think that's happening. But that is one way of targeting or mechanizing that. We do also have some emphasis programs that do come into play and do have priority. Very little follow-up inspections. So if we see people that are, not acting safely at our drive-through, we would stop and do inspections. Aerial lifts, things like that, if you're working off of rough terrain lifts, if you were looking at baskets, looking at a lot of how they're attached. So we have our general schedules, local emphasis programs. In construction, if you're doing trenching, you're going to get looked at. If you are on a roof or an elevated or put up trusses, you're going to be looked at. Powered industrial vehicles, we have a very high focus point. Lead and silica. Road building, making sure the signage is up. I drive 1,000 miles a month, and if we drive by and there's no signage where you're working on your road, you're probably going to get somebody stopping and asking you some questions. When we do the inspection, we start to initiate the inspection, we present credentials. It should say who we are. If you have any questions, and sometimes it does come up, we do have business cards. You can call the office and see if we're really who we say we are. We do have what's called an opening conference. We tell you the purpose and the scope. Why are we there, and what are we going to do? Sometimes the scope changes as we see more and more issues. Sometimes it gets very limited. We would look at any injury and illness records on site, construction-wise, not so much. But any of your programs, material safety data sheets, fault protection plans, anything in writing we would look at. And we go out and walk around the site, look for apparent violations of safety and health standards. The biggest thing that OSHA has is showing exposure to a hazard. That is the key to an OSHA violation. So we could have the nastiest thing in that room. As long as we keep the door shut and nobody goes in there, it's not a problem. The moment we open up the door and somebody walks in, now we have a problem. So a lot of our interviews, a lot of our discussions go to that point. At the end of the conference, or at the end of the walk around, we have a closing conference. Before we leave the site, you should know what may or may not get issued on a citation. What we sometimes cover a lot of items and only a few get issued. Nobody ever complains about that. But the citation actually gets written and approved at the supervisor level, area director level, gets mailed to the company. The company signs for it in a green card. That starts what we call the contest period. You have 15 working days to do some sort of appeal method. So if you want to contest the citation, you could just send us a letter of a contest. If you want to have an informal conference in the Eau Claire office and talk to the area director or the supervisor about the issue, you can do that. So the thing we recommend is have the informal conference. If you don't like what you can work out at that conference, you can always contest as long as you keep that 15 days in mind. You do have to post the citation so the employees can see what was happening. The violations are categorized as other than serious. There generally is no penalty, sometimes posting, things like that. Serious is if a serious injury or illness is most likely to occur because of the condition. Repeated is if we find the same standard violated in the last 5 years. That's a change. It used to be 3 years. Willful is if you willfully disregarded safety and health. Failure to abate is if you don't correct something, we go back on a follow-up and we find that it's done. This is the biggest change that the administration has done, the new administration. We went to Congress in 1992 and congressionally changed the OSHA penalty structure. So since 1970, 1992, penalties were changed, and what was done here is just we took out all the little loopholes. So a lot of the adjustments that used to happen on penalties went away. So what the idea now is the same maximum exists, but we've increased everything underneath. So we would look at if your likelihood of the condition would cause a fatality, that would be high. If the frequency or the proximity to the hazard would be very close, or you do it all the time, it would be a greater, and that penalty would start at $7,000. Low lesser would be something that would be like stitches, and you don't do that process very often, or you're not very close. They've also changed how they add up the penalties. So just rather than take the total amount of penalty reductions or the percentage and then take that off the top, they do it just at little bit at a time. And mathematically, that increases the penalty. So if you are a medium-sized employer with 50 employees, 4 years ago you got a high grader citation, but you have a pretty good safety program, what would have calculated out to $500, now calculates out to just shy of $3,000 per item. So it's one of those things, you guys are in the construction business, construction's not doing very well as we just heard. You can't afford to have OSHA penalties because the cost is going up. We talked about that. A couple just concepts with OSHA, wrap this up. Make sure in the construction field you know when you need a competent person and that your competent person understands what they are supposed to do. If you're doing trenching, scaffolding, fall protection, competent person comes in play. And it's a person who is able to identify existing or predict hazards in the surrounding or working conditions which are dangerous, and here's the caveat, and who has the authority to take prompt corrective measures to eliminate them. A lot of people go, well, yeah, we didn't get all the fall protection from the shop, so we continued to work. That's not a competent person. Competent person says all the fall protection didn't come from the shop. We are going to do a different task until they bring us what we need. So that is one of those issues with OSHA is defining a competent person, making sure they're acting as such. The other is multi-employer worksite. You have this big project or a project and you got a number of different contractors coming in. Your electrician leaves the cover off the box. It's really everybody's problem. So if you're dealing with a bad ladder setup, we were able to issue citations for who put the ladder up, who had exposed employees who went up and down that ladder, who was supposed to put in stairs or a safe ladder, and who has the control or oversight of the project, so your general contractors. So we're able to loop in 4 different groups under one, with one condition. So be familiar with our multi-employer worksite policy. Told you we have a 1-800 number for reporting fatalities or any other issue. Workers can also use that. State consultation is a free service offered by, it's actually funded by federal OSHA, state level administration. They come to your work site upon request and help you through the safety and health program process. Your only obligation to them is to correct what they find. So they don't report to us. It's kind of like your parish priest. We run it differently. We don't talk to them. And maybe, I don't know your parish priest. Maybe it's that a good thing. Website has a lot of information. A lot of the handouts that we have are called quick cards. A lot of things if you're trying to get training materials, various things. A lot of times when people have questions, they call me and I say, oh, are you at a computer? And they go, yeah, okay, well, log into this and that and that. And I can walk you through our website to show you where to get to that information. We have 4 offices in Wisconsin. Enforcement-wise, these are fixed borders. I travel throughout this state of Wisconsin doing various things, Minnesota, and later this week to Hawaii, courtesy of federal government. Pearl Harbor for a full week. Couldn't turn that one down. And so there's compliance assistants, if not two, in every office. And I guess we're holding questions till later. I, too, have a disclaimer, and I don't work for the government usually backs up what I say, but every now and then something slips out. All right.
Thanks, Mary.
Yeah, PowerPoint.